Next, we're going to talk about the impacts of community violence on mental health with Mr. Dexter Clarke. Dexter Clarke was born and raised in the city of Flint, Michigan. He graduated from University of Michigan-Flint and has worked over 40 years in the behavioral health field. He's proud to be a Flintstone because, like the stone, this city is filled with individuals that are resilient and stronger than steel. And now present Mr. Dexter Clarke.
Thank you, Elena. And I'd like to welcome everybody again and thank you for having me to be a part of this. And what I want to talk about, my topic dealt with dealing with impacts of community violence on mental health. But before you understand that, you have to realize that you got to have data to back, things that you're talking about. You can't just talk off the top of your head. And so I'm a firm believer in data, but not only any type of data, but accurate data in regards to mental health, in regards to other issues that affect our community. So what I want to do is, first of all, talk about there is a correlation between physical health and mental health. It used to be that you thought that as long as I'm physically active and physically healthy, then I'm good. But you need to be mentally healthy too. And just like with physical health, where you have to exercise, eat well, and do things, mental health, you have to do the same thing. You have to make sure that you're taking care of your mental functions and your ability. So what I want to do is first to show you data, statistics that talk about, mental illness, because that is something that is real. Some people try to ignore it or try to say that it doesn't exist. And even in the Black community, for years, we would not acknowledge mental health issues or mental illness. But I want to show you some data that supports that mental health is important and that mental illness is a great concern in not only our nation, but the world. Next slide. These are some statistics from the National Alliance of Mental Illness called NAMI. And one thing we need to know that in the United States, 1 out of every 5 adults experience some form of mental illness. And when I say that, it means basically that they have some form of mental illness, which may be, bipolar or mood disorder. It may be anxiety. It may be schizophrenia, but it's not to the point that they cannot function. They're able to live their lives and move about without basically probably any treatment other than doing supports that they have in place. So 1 in every 5 adults experience some form of mental illness. And this is data from 2021. Now, 1 in 20 adults experience serious mental illness diagnosis. And what that means basically is that it is such a great nature or such seriousness that they need to have assistance. They're not able to function independently in the community or to do things without some form of treatment. So that's 1 in 20 adults. Mental illness also affects our young people, our youth. And young people from the ages of as young as 6 years old, up to 17, there's 16.5% of our youth in the United States that experience some form of mental illness. Now, also, when we talk about adults, we see that 7.6% of those adults that have mental illness also may have or will have some type of co-occurring substance use. That means it may be alcoholism or, substance use, dealing with drugs, talking about opiates and other things. So that even compounds the issue of dealing with not only mental illness, but now you have a substance use disorder that goes along with that, which makes it even more difficult to function and to just get by from day to day. Next slide, please. Additional statistics, as we look at the demographics, how does that break down as far as races? Well, we see that, 16.4%, the smallest percent of individuals in a particular race affected is the Asian community, 16.4%. The highest community that is affected by mental illness is the lesbian, gay, or bisexual community, where you have 50.2%. But also, when we look at that, we see that the Black community, if you could go back a slide, please. Thank you. 21.4% in the Black community are affected. So you're talking about almost a quarter of Black Americans in the United States suffer from mental illness. Next slide, please. Now, when we talk about receiving treatment, we look at that adults with mental illness in 2021, 47.2% of adults received treatment for mental illness. Now, that's less than 50%. So you must think that at least 50% of individuals with mental illness that are adults are not receiving treatment, which is not good. And we'll talk a little bit later about the social determinants of health. And that is part of the reason why we only have less than 50% of people, adults receiving mental health services. Now, adults with serious mental illness, once again, when I talked about that illness that impacts you to a point where you can't function without any form of treatment, we have at least 65% that are receiving some form of treatment. But that still leaves you a little bit more than 30% with serious mental illness that do not receive any form of treatment. When we look at our youth, again, we have about 50% that are receiving some type of treatment for mental health disorder. And this is 2016 statistics. But then even with that, you still have a little less than 50% of youth from the ages of 6 to 17 that are not receiving any form of mental services or treatment, which means that they're trying to make it through life dealing with this serious mental health issues. The concern too, the statistic that really concerns me too, is that they say the average delay between the onset of mental illness when somebody first is recognized as having mental illness and receiving treatment is about 11 years. So just think about that's an average total. You know, that for many people, it takes about 11 years before they receive treatment. So they are dealing with this for at least 11 years before receiving any form of treatment. Next slide, please. Now, when we look at the treatment, you know, who's receiving it according to different races, we see that as far as Black Americans, we're receiving 39.4% of those that have a mental illness are receiving treatment. The greatest amount of those that are receiving treatment are the lesbian, gay, and bisexual, which is at 55.6%. But once again, looking at our community, less than 40% of us are in the Black community are receiving any type of mental health treatment. Next slide. 2018 census data shows that more than 1 in 5 Black Americans and people in the U.S. live in poverty as of 2018. And even with that, 30% of the Black and African American households in American women are the heads of the house. So what that is saying basically is that there's no male figure in the household, that the woman is being the father, the mother, the provider, and all of those type of things. And that does have a great impact on the mental well-being, not only of young men that are growing up in a home without a father figure, but even women, you know, that are looking for a good, strong father figure to emulate, or not to emulate, but to show them what a good father figure looks like, what a good man looks like, which a lot of times leads them to making choices of individuals that are not really good role models, but male role models for them. Next slide, please. Mental Health America reports this. It says historically adversity, which included slavery, sharecropping, and race-based exclusion from health, educational, social, and economic resources, translates into social economic disparities experienced by Black and African Americans today. And basically what that is saying is that it is nothing that just happened to us overnight, but this has been a historical timeline, you know, dealing for years, that has affected us to be excluded from proper amount of health, educational, social, and economic resources. And also because of that, it has caused us to also have issues with our mental health. It says also socioeconomic status in turn is linked to mental health, and people who are impoverished, homeless, incarcerated, or have substance use problems are at a higher risk for poor mental health. So basically what that is saying is that if you don't have a good living situation, if you're homeless, if you are incarcerated, or you have substance use problems, you stand a higher risk of experiencing mental health issues. So once again, showing the importance that mental health makes a big difference on how we are able to live, how we function in life. Now, Dr. Key has talked about and has been a very strong proponent and advocate for what he calls social determinants of health. And basically what that is saying that where a person is born, where they live, where they work, where they function and how they age will affect their ability to have a good mental and physical health. And so when we look at this, when we look at, the ability or the idea that mental health and mental illness is something that is substantiated, that shows that it's in our community, that it affects us, then we have to look at also what other factors are affecting us, where we live, if we're living in an environment where there's violence, as we're talking about that today, if we're living in an environment where there's, poverty, where we're living in an environment where we're not provided with adequate health care, then that is going to cause us to react in a normal way, in an abnormal way, I should say. When somebody is not feeling well, when they're not able to function and to think clearly because they're worried about whether or not the lights are going to be on. I heard one of our presenters talked about too, having to make a difference on whether or not to provide health care or food. Those are things that are very stressful and have a great impact on our mental well-being. So when we look at people living in an environment that's like that, where they don't have the proper health care and also dealing with violence, and as you know, we're seeing an increase in violence, especially gun violence. And I just want to give you some data on that. Looking at the CDC, they said that nearly 25,000 lives are lost to homicides in 2020, 25,000 in America. Community of violence not only affects millions of people, but it affects families, it affects schools, it affects also communities every year because of that. 1.4 million people are treated for assaults in emergency departments coming in. So that is a great number of people. And over half of the US homicides occurred among people ages 15 to 34. And that was 2020 statistics. So we're seeing that over half of those are young people that are being affected by that. It says that people's health outcomes are influenced by conditions in which they live, work, and play. Once again, going back to the social determinants of health. Where we live, where we work and play affects us in our outcomes, how we live, how we interact with people. Communities of color often disproportionately experience these negative conditions, placing them at greater risk for poor health outcomes. So what is the problem? What is going on? And I want to talk about, I know we're dealing with addressing older adults, talking about that, but we're talking about community, our community as a whole, not only older adults, but our community of color. What are we dealing with? I talked about mental illness. And as you've seen statistics, as you've seen the news report, when we've had all these mass shootings, they're very quick to talk about the mental status of that individual, that they're mentally ill. Well, I want to clear up a myth. I've been in behavioral health for over 40 years, and I can tell you, and statistics show that most of those violent acts are not caused or perpetrated by people that have been diagnosed with serious mental illness. Now, that doesn't mean that they may not be in a mental crisis. They may be overwhelmed and, they may be reacting to stress or anger, but very few. In fact, I think they said only 25% of those type of mass shootings have been done by people that have been diagnosed with a mental illness. Okay, so that's something that we have to realize. Also, we have to realize too, that what causes that, what impacts our community to make it unsafe? Why are people so angry? Why are people resulting to violence, especially in our community of colors? Well, a lot of that has to deal with, once again, we go back to the social determinants of health. If you live in an environment where violence is constantly seen, children growing up in a household where they witness violence, maybe to the mother, by the father or the male figure in the house. They've witnessed gun violence in the home. That causes people to become stressed. And many times that can lead people to develop, a form of mental illness, develop anxiety, develop depression, things of that nature, because you're witnessing that. And for a child to have to witness those type of things, and even an adult, it causes a great effect on how they deal with, stress, how they deal with anger, because they are seeing examples, not good examples, of how to deal with that. So they're in an environment, a home environment, where for one thing, you're looking at poverty. Maybe the lights are not on. Maybe they don't have water in the house. And then that is causing stress and anger with, the parents in the house. They're upset. They're dealing with that, not knowing how to address that, and also not being able to find resources to help them with that. Then they react out of violence. They react out of anger. So we say that type of violence, and the child witnesses that. The parent witnesses that, and that carries on. And a lot of times they feel that, well, that's the way that we deal with it. So a child will go out into the community and maybe feel that if that's how they deal with it at home. So if I'm dealing with an issue that is not correct, if I'm dealing with an issue that I don't like, that makes me angry, then because I see it being emulated in the house, this is the way that I need to do it, which is not a correct way in which doing that. We also find out, as I stated, that, when you're experiencing those type of things in a household, when you're dealing with things that deal with, not providing you adequate resources to deal with anger, adequate resources to deal with getting proper health care, when you're not feeling well, then that affects your mood and it makes you a little bit more irritable or a little bit more angry. When you go to get services and you're treated, in a disrespectful manner, or that you're not worth it, that causes anger and confusion and making people upset. So when we see that, that can lead to depression. And one thing that we know in behavioral health is that many times depression can cause people to start thinking about suicide. In fact, we know that on an average in America, there are 132 suicides that occur every day, which means that every 11 minutes, someone has completed suicide. And I say completed instead of committed suicide. And we say completed because when you say commit, that means many times that you've thought something out, that you're rational, and you're making a clear choice. When you're committed to coming to work every day, you're thinking about all the negatives, the pros and cons, and you say, I need to go to work because if I don't get paid. But when people are completing suicide, it's because they're so overwhelmed and that they feel that that is the only way out. So that's why we say they're not thinking rationally, but it's like they're saying that there's no other way out and I'm feeling hopeless. So we say that they complete suicide, but they have not been committed because they have not made a rational process of thinking what other options are available. So that's why we say that. We also know that at least 50% of all suicides is done with firearms, and that men are 3 times more likely to complete suicide than female. The reason being because men will use a firearm, while females most of the time will use things like overdosing on pills or drowning or suffocation. So a man, when he completes suicide, it's more lethal with a firearm. And that's why we see a higher incidence of men completing that. So what does this all say? How do we deal with it? How do we resolve, or how do we address community violence and mental health? Well, for one thing, we have to advocate that there be equity in communities of colors for health issues, mental health issues, and that we get quality and that it is in the community. Another thing is that we have to hire or vote in politicians that will support the community and listen to the voice of community. We have a voice. Years ago when Dr. Martin Luther King was around and we talked about civil rights, it was the voice of the people that made a difference. They got out, they voted, they were educated on what the dilemmas and what the issues were, and they voted to put people in that would support them. And that is what we have to do. But also as a community of color, we have to be honest and transparent about what we're struggling with, especially the Black men. We've been told for many years that, we're to be strong, we shouldn't show emotions, and that, we just have to move forward. But we have to address those issues. And then we have to be willing to get the help for those issues. So by, providing services in the community that are equitable, that are fair, by people being able to see people like me providing those services gives me, encouragement. So we need to have more people in the medical, in the health field, in law enforcement, people that understand, what we're dealing with, what we're going through. This will help to impact the community. And I'd like to say that as I see, and as I stated in my introduction, I am a Flintstone, I support Flint. I see us making a turnaround. I see organizations like the one putting on the symposium where people are saying, that it's about the community. It's about doing better for the community and helping them and being vocal when we're not being helped. We have to continue that. And it's not about being in the limelight and getting all the glamour. It's about those small organizations that are diligently working day to day, reaching out to people, providing for services, advocating, and getting legislation to move forward, to deal with gun violence, to also deal with proper and adequate mental health and medical health as well. So again, I want to thank you for allowing me to speak. I hope that this has been informative and that it has helped you. Thank you. My agency, Genesee Health System, if you have any questions about the services, you can reach out at 810-257-3740. That's a central number that will get you anywhere. If you want to talk to me directly, you can call my office number, which is 810-496-5409.